Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor. This show is dedicated to the education of our viewers. The topic for tonight is Dentistry Today. My special guest is Dr. Madhuri Chowdhury. Dr. Chowdhury obtained a BDS degree from India. She attended Tufts University School of Dental Medicine in Boston, Massachusetts, graduating in 1998 with her DMD degree. She is currently practicing in White Plains now at First Advantage Dental and is proficient in all aspects of general dentistry as well as cosmetic dentistry. She has a sincere commitment to excellence. Dr. Chowdhury believes in an approach where preventive care, restorative dentistry, and cosmetic treatments can interact positively to promote good oral health. So I'd like to welcome Dr. Chowdhury to the show. Welcome, Doc.
Thanks.
Okay, Doc, we're going to start with the first question, which is why does everyone have to go to a dentist every 6 months?
Yeah, nowadays everybody is concerned about their overall health, and they tend to more focus on their diet and exercise. So along with that, I think it's very important to maintain their oral health also. So going to dentist regularly will provide preventive treatment, and that will allow them to reduce their any chances of future problems.
Sure.
Many patients they do not go to dentist regularly.
Right.
They may feel that it's not necessary to
Sure.
go. They may feel they are saving money.
Right.
Or maybe they're just scared to go to the dentist.
Right.
Or most of the time here, I have no problem.
Right.
My teeth are fine. But the problem is the dental symptoms, any problems that come, it doesn't show any symptoms until it reaches to the advanced stage.
Right.
So let me give you an example.
Please.
If there is a toothache, that means most probably there is a cavity that's reached close to the nerve.
Yes.
So in order for you to save that tooth, first thing you'll need root canal treatment, then followed by post and core, then the cap goes over it.
Right.
And if patient doesn't want to save that tooth, or if it's not salvageable, then in that case the tooth will have to be extracted. Then
Right.
it needs to be replaced with something such as an implant or
Right.
or a bridge or
Sure.
a removable prosthesis. So if this problem was detected in earlier stages, then it could have been just a simple filling.
Right. Right.
So point of telling you
Preventive.
is that preventive care will save visits, and you will save money in long run.
Perfect. Great. So what could I expect if I came to your office on the first visit? What is typically done in the first visit to a dental office?
Yeah, usually the first visit is usually scheduled with both dentist and the hygienist.
Right.
So that includes your thorough dental examination.
Right.
So usually we do 5 assessments.
Right.
The first assessment is the risk assessment. That relates to if there are any medical history. Then soft tissue or the oral cancer examination.
Right.
Then occlusal assessment, where we evaluate if you have any TMJ problem, that's temporomandibular joint, we check your bite. Is there any parafunctional habits such as clenching or grinding? Are they causing any occlusal disease?
Right.
The fourth one is the restorative assessment, where evaluation for active decay or any broken down dentistry. Finally is the periodontal assessment, where we evaluate the conditions of your gum and your surrounding bone tissue.
Right.
So then after that, hygienist will perform thorough cleaning, give oral hygiene instructions.
Right.
And then based upon all these assessments, dentist will formulate a treatment plan.
Right.
That takes your immediate needs and your long-term goals into consideration.
Perfect. Perfect. So let's get right to flossing. Okay. And why is it so important? Is probably so many people do not do it, but isn't brushing twice a day enough? You know, most people brush in the morning and the night, and that's it.
It's a good question.
Go ahead.
Well, flossing and brushing, they're both complementary.
Yes.
They both remove the plaque from your tooth structure, but they clean 2 different parts of your tooth.
2 different parts.
Right.
Okay. There we
So
go.
plaque is, you know what plaque is, right?
Sure. Well,
So
I don't know. I know. What is it? Tell tell the
All
audience
right.
what it is.
Plaque is a sticky, colorless film of bacteria that forms every few hours on the tooth.
Right.
So after eating snack or any food containing sugar, there are bacteria in your mouth that produce acid.
Yes.
That acid weakens your tooth enamel and that causes cavity.
Right.
So plaque not only affects your tooth, it also affects your gum.
Okay.
By destroying your gum tissue and your surrounding tooth structure.
Right.
And if that results in inflammation of your gum,
Right.
and that's known as gingivitis.
Right.
This is reversible. If the plaque is cleaned out, you can get back to your healthy gum tissue there.
Right. And brushing is not enough to do that.
Not enough. And if this plaque stays on your tooth for a long period of time, then it gets mineralized. It turns into tartar. If that stays, then you get periodontitis.
Right.
So therefore, brushing is required twice a day.
Yes.
Flossing removes the plaque which is in between your teeth, that where the toothbrush cannot reach.
So it goes deeper than a toothbrush could ever go.
That's correct.
Okay.
So I have some models over here
Yes.
that actually can help you understand it.
Sure.
So this is the brown stuff that you see, that's your tartar.
Yes.
All right?
That's it. Yes.
And usually if you notice the color of this gum, it's like pink over here, and you can see it's red and
Much
swollen.
more red on that side, sure.
So this is how patient is normally.
Right.
But just for your information, if I actually pull this gum down, you can see the difference in gum, what the effects are. So the yellow part is the bone tissue.
Yes.
This bone level is supposed to be over here. Now that brown stuff is the tartar.
Right, and
So
you don't see that.
And you don't see this. So once this tartar is cleaned up, it can get back to your normal, healthy pink gum.
Okay.
But if you notice, see the gum line, it has receded down.
Yes.
That's because this was hidden.
You see the
because
little
of
line here, right? These lines on the bone? Is that what you're seeing where the receded gum is?
Yep. So
Okay.
at this point, your gum was supposed to be.
Yes.
Now it's receded down.
Okay.
And this was hidden because of this swollen gum. And this can become very sensitive.
Yes.
If at this stage, if it's not treated, then there is a more destruction.
Right.
More destruction of the bone. You'll get bad breath. There will be infection. Eventually, tooth will become loose and it will fall out.
And you lose. Perfect. That was a great explanation, Doc.
Thank you.
Okay. So, flossing, brushing. How often should you floss?
Well, at least once a day.
At least once a day. You'll take that.
Yes.
At least. Okay.
So, plaque can be removed by brushing and flossing, whereas tartar cannot be removed by brushing and flossing. Only dentist or hygienist can take care of that.
And that's where the dental hygienist, or
That's
when you
why-
get your teeth cleaned.
Right. That's where you come for regular
Because
cleaning.
you can go deep and then we can go for sure.
Sure.
Okay. Last question on that cleaning. How about a water pick? Is that helpful? I mean, a lot of people use a water pick maybe because of it's quicker, or just explain that.
Right. Well, water pick dislodges large food particles. So it is good to use it when patients have braces, implants, or any gum problem. So it's easy to dislodge the food particle, but it's not a substitute for flossing.
Okay, great. Good
It
answer.
doesn't remove the plaque.
Okay, got it. Does not do it.
No.
Okay, so there we go. Great answer. Cavities seem to be the most common problem that people go to dentists for. What are some options for treating cavities?
Yeah, it's a very common problem that we see. Usually people get a lot of cavities. So it all depends on how extensive the decay is.
Right.
If decay is not extensive, then in that case the decayed portion of the tooth is removed and it's simply filled with the filling.
Yes.
Like white filling, that's like composite filling,
Yes.
or porcelain filling, or even silver amalgam filling.
Right.
If the decay is extensive and not enough tooth structure is present, then you will need a cap put on there.
Okay.
And sometimes a cavity can reach very close to the nerve. So in that situation, the root canal is needed, where the nerve of the root is taken out along with the decayed portion of the tooth,
Yes.
and then which is followed by post. That is a pin that goes in one of the canal, and then the whole tooth gets built with the core material,
Right.
and then on top of that the cap is put on.
Right.
And that is necessary to protect your tooth from fracturing it.
Right.
In advanced cases where tooth cannot be saved, then the tooth will need to be extracted.
Removed. Okay, good. And hear a lot about mercury-based fillings that are bad for you and should be replaced with composite white fillings. Is that necessary to do, in your opinion?
Well, mercury-based fillings are also called as silver amalgam fillings.
Yes.
It's still a controversial topic. That's because people believe that mercury causes some diseases such
Yes.
as multiple sclerosis, autism, Alzheimer's disease, but it has not yet been definitively proven.
Okay.
But however, we still use it in US.
You still use it. Right.
Right. But there are many people who still have silver amalgam fillings.
Right.
So the way these fillings stay in the cavity is by mechanical retention.
Yes.
They pack those things in the cavity. And since they are metal, it reacts with the temperature. So every time it comes in contact with hot and cold, it expands and it contracts. So it causes tension around the tooth structure and eventually it weakens the tooth. So if we see that fillings are show any signs of failure,
Right.
then in that situation we can remove the filling and replace it with white filling, that's composite filling or the porcelain fillings.
Great. Okay. So, and that's what you would use in your office mostly? Is that
Yes,
when necessary?
Right. I do not use any silver amalgam fillings, only white fillings or the porcelain fillings.
Okay. And are composite and porcelain bonded restorations used only for cavities, or are there other procedures where they're used for?
Yes, it is used for other procedures,
Yes.
such as if they have chips or cracks on the teeth, if there is a space between your tooth, you want to realign your teeth or reshape your teeth. If there are any exposed root structures that you want to protect it, and sometimes also to address the problem with abrasions and effractions areas.
What is an effraction? Please, if you could describe that.
So there are two things that we see very common nowadays. Their abrasions are usually saucer-shaped. Effraction areas are V-shaped notches.
Yes.
Now, abrasions are usually created when patient brushes very
Vigorously,
aggressive,
hard.
or improper brushing, and it usually shows like a recession of the gum. And whereas these effraction areas, they are usually associated with patient with clenching or grinding their teeth.
Right.
So this way you'll understand it better. Say if this is a tooth,
Yes.
and that's the neck of the tooth,
Yes.
right? At the neck of the tooth, the enamel is very thin. So every time there are excessive forces put on,
Yes.
it tend to wear off this enamel from here, and
Right.
that creates these V-shaped notches.
Perfect.
So both these abrasion and effraction areas can be filled with the composite filling to protect your tooth and of course to improve the appearance of the tooth.
Sure.
So usually when I see the patients, because if they cannot change their brushing habit, at least they'll wear the filling rather than your tooth structure.
Right. Sure.
So when I see the patient, I always tell them, don't show your frustration on your teeth. Go easy on them.
I love that. That's great.
And for effraction, of course, if they are clenching and grinding habits, we fabricate occlusal guards, and if there are severe cases, there are other treatments available. But I do have a picture for you
Okay.
to
please.
show where the you can see the abrasion areas. So if you notice at the gum line, there are these brown areas. They are kind of saucer shaped.
Yes.
So in this situation, I filled it with the composite restoration, and that's how
Wonderful.
that looks like it.
Right. And it lasts for years?
Yeah, if you keep brushing hard on it, then of course it's going to wear
Right.
off.
Just change
So,
your habits and it should
right.
last for a long time.
Yes,
Great. That's great. Good job.
thank you.
Okay. Now, say something about porcelain fillings. Is that pretty much what we're talking about here?
Yeah, porcelain
Porcelain.
fillings, when I say that, we normally refer it to as inlays and onlays.
Okay.
So these porcelain fillings, they are lab fabricated, custom made, they're bonded porcelain restorations.
Right.
They are both composite and the porcelain, they are both bonded restorations.
Right.
But if it's compared with composite restoration, porcelain restorations are long lasting, they are durable, they are more stain resistant, and they are very strong.
So there are some options. I
There
mean,
are
right
some-
from
yeah.
the old silver filling to really
Sure.
something much more
And
advanced.
every material has its own pros and cons for it.
Perfect.
So
Great.
if you are interested, I have
Yes,
picture
please. Let's see.
for. So this is the old mercury filling.
Yes.
And if you see, there is a dark margin around it. That's the decay that's growing in there.
Yes.
I have the another angle for the same tooth. On the back of the tooth, there is another mercury filling with the cavity growing next to it.
See.
So in this situation, since it was a large filling, we restored it with the porcelain onlay.
Oh, wonderful. So you took care of the cavity plus the silver
Removed
mercury.
everything, cleaned it out, and this is the another
Perfect.
angle of
Looks
that
like a brand
one.
new tooth.
Right.
Right back.
And this is the, like say, another example of composite. If I have to give you, this is the cavity.
Right.
We remove the cavity, and then that's filled with the composite filling. So it
Beautiful.
looks aesthetically
Perfect.
pleasing.
Yeah. Terrific. That's great, Doc.
Thanks.
Good. You talked a little bit about a dentist can help to maintain oral health when we first opened, but a dentist can also help change the appearance of your smile, right? So can you describe how you might do this?
Well, having beautiful smile is indeed helps you bring up your self-confidence and happiness.
Sure.
So as teeth age, teeth show wear, discolor. Sometimes the old fillings become more discolored. There are more chips and cracks on the teeth.
Right.
So let me give you examples so you can understand how we can change the appearance of your teeth.
Please.
So say if you do not like the color of the tooth, then you can just whiten your teeth.
Right.
If there are chips or cracks, or if it shows wear, then you can get composite or porcelain veneers or caps put on them.
Yes.
If it has gap between the teeth, or if it has crooked teeth, then maybe the option would be braces, Invisalign, or even porcelain veneers.
Okay.
And if the teeth are missing, then of course you can replace them with an implant or bridge or removable prosthesis. So
Yes.
when we are diagnosing the whole area, we need to first see what the problem is, and then how we can improve upon it.
Right.
So-
Always try and find a proper diagnosis and then go
Exactly.
forward. Right. Otherwise, you're lost.
That's
Okay.
right.
All right. If there's a gap in my front teeth, how can it be fixed? If you have a gap, I would think that it would be braces, but is there other options? Another
Yeah.
option?
So this is again depending on the diagnosis,
Right.
overall diagnosis.
Mhm.
When there is a gap, first we need to see, is it as minimal or is it large? How are the rest of the teeth? Are the shape of rest of the teeth, or do they have smaller, the shape is smaller compared to the other? Are they in proportionate with other teeth? Many different factors to be taken into consideration. But say, for example, all your teeth are in proper alignment.
Yes.
If it's a minimal gap, you can easily fix with composite filling
Right.
or the porcelain veneers.
You can actually fill it. Don't
Yeah.
have to go through a whole
No,
braces.
if it's a small gap, that's what we would do.
Okay.
And it can look great after that.
Sure.
But if there is a wide gap, then we need to take into consideration how it's going to look like.
Right.
So sometimes we need to fix maybe 4 teeth, or maybe even 6 to 10 teeth for that matter.
Right.
If I just have to treat 2 teeth for that, just to fix the big wide gap, it
Yes.
will not look good. It will look out of proportion.
Right. Of course.
So usually that is referred as having chiclet teeth.
Right. Okay. Gotcha.
So it all depends on the diagnosis again,
Right.
we have to take into consideration the whole mouth
Right.
to improve the
I see you're very much into the cosmetic part of this too, to make sure the person not only feels better but looks better.
looks
right?
better, of course.
Okay, so if a front tooth is chipped, I guess the same. Does it need to be capped all the time, or you can put the composite, or if there's a chip to the tooth?
Right. Once again,
Yes.
we have to see how is the arrangement of the teeth, what's the age of the patient, how is the bite, and most importantly, how extensive the fracture is.
Right.
If the fracture is minimal, we can again do like a filling, composite filling, or porcelain filling,
Yes.
porcelain veneer that can solve the problem.
Mhm.
If the fracture is extensive, then in that case you may require a porcelain cap put on there.
Right.
And sometimes in certain situation you also need root canal treatment
On that.
for that. So I do have a picture for a kid. This is a small young kid who, it's not a greatest picture, but
Right. It's okay.
it's a small kid who fell down and broke their front tooth.
Right.
So this was simply fixed with the white filling.
Terrific.
So the advantages with white filling, it's single visit. In
Right.
office, I can fix that one for you.
One minute. Got it.
The problem is it can stain easily. It is more prone to fracture.
Ah. Okay. Right.
So-
So, okay, you repair it,
So-
hope for the best, but if
Yes.
not, you may have to.
You
put
have to
a
always
re-
take care of it.
Okay,
Right.
go further. Gotcha.
Right.
Okay. So nowadays, people want their teeth to be really white. Okay, what are the different options available, and what is the quickest way to get it done?
Well,
I hear a
Teeth-
lot about that. Teeth
Yes.
whitening.
Teeth can look darker because of having different stains on their teeth.
Right.
Now, stains can come from tobacco, from smoking. Also, people have habits of drinking tea, coffee, red wine, any colored liquids that can stain your teeth.
Right.
So once we remove all the stain, it can look better.
Right.
But if you still do not like the color of teeth, then there are few options available,
Which are?
which are the over-the-counter options, like whitening products
Right.
that you can buy. It does work, but it takes long time to get your teeth whitened.
Okay.
If you want faster results, dentists can fabricate bleaching trays. Then you can do it at home.
Right.
Those trays normally last for a long time.
Longer if you get it done professionally, I would think.
Yes.
It would last longer.
No, the trays can last for a long time. So if you need any touch-ups, then you can always put it
sure.
and you can use it again.
Perfect. Okay.
If you want, or there's another option is in-office bleaching.
Yes.
So that is normally done in 1 hour, which where most of the time you can see immediate results
Okay.
with it.
And will last long as well.
Yeah, it will last long if you take care of it,
Right,
if
yeah,
you
of course.
maintain your
Right.
hygiene
If you
and all of
get
that.
rid of the
Right,
red wine
right.
and all the other things.
Yeah.
Okay. Gotcha. Okay. So what is the most common problem after whitening? Is it the going back to being poor color?
Most common problem we see right after whitening is actually sensitivity.
Okay.
Not everybody experiences it, but the patient, those who experience, probably they have like thin enamel on it, so they feel more sensitivity. Or if there is any dentin exposed, like in say example where the receded gums or abfraction areas. So in those situations, you may have more sensitivity. So products whitening products can increase the sensitivity with it, but it is temporary. It goes away.
Okay. And how do you maintain the whitening afterwards?
It all depends on your oral hygiene.
Excuse me. Yeah.
So
Excuse me.
if you maintain your oral hygiene, it would last for longer.
Right.
You can always use whitening toothpaste, which they usually contain like a gentle abrasives in it,
Right.
so it can remove stains. So once the teeth are clean, and if you still need on top of that, you can always do the touch-ups.
Gotcha. Perfect. So coming close to near the end, we got a couple of minutes left, but let's talk about dental implants, which are common these days also.
Mm-hmm.
All right. So what are they and when do you use them?
All right, implants are used widely nowadays. So an implant is a titanium screw
Mhm.
that simulates the root of your tooth.
Right.
and then the bone forms around it.
Mhm.
All right. This is the one of the replacement option for missing teeth.
Right.
It is the permanent option. The good thing is there are no decay issues,
Right.
and it also helps maintain your bone.
Mhm.
So once the implant gets integrated, then on top of that, we can put a small extension, metal extension that sits on top of the implant, and then the cap goes right over it.
Oh, so I see. Yep. Perfect. Okay. Does your body, or can it reject an implant? Are there ever issues with that? I mean, a lot of people are nervous about that because it is surgery. You know.
Yeah, I mean, see, implant is made of titanium.
Mhm.
It's very biocompatible, and
Right.
allergy issues are pretty low with it.
Low. Okay.
So sometimes if there is infection or if there is any excessive forces are put on, it can fail.
Right.
But research studies have shown that it has 97% of success rate.
That's huge, and that's really high. That's
Yes.
great. Okay, so our last question, Doc.
Yes.
All right. I see advertisements about Invisalign. That's Invisalign.
Yes.
Okay. And so, what is it exactly?
Well, Invisalign is a series of plastic trays or plastic aligners. Those fit comfortably over your teeth.
Right.
They're like thin trays that you can see it.
Oh, sure.
And
That's then easy.
yeah, and these aligners we give each aligner they wear it for 2 weeks, and then we give them a different sets of aligner where you can change. This actually corrects your minor crowding or spacing, etc.
Does that replace the brace that what most
Well,
people used to
it
seeing?
is a alternative option for it, but
Right.
in certain situations, still traditional braces are the best option to go.
Still the best option. So you have to be a candidate for that Invisalign. I mean, after a careful evaluation by
Right.
someone like yourself,
That's right.
right? And then you'll make that decision and offer it to the patient.
That's
Okay.
right.
Does that take longer to correct? It seems like it looks a lot better. So, but does it take longer to
It
correct
depends.
the same kind of problem? Or?
It depends
Okay.
how much crowding you have. How many teeth needs to work on, things like that.
Great. Okay. Well, Dr. Chowdhury, I want to thank you for being on the show. That was terrific.
Thank you so much.
And I do want to thank Dr. Chowdhury for being here. And if you have any questions about dentistry or about your teeth, you can email Doctor or look at our website. And we look forward to seeing you on the next show. Thank you.
Thank you.